My name is Mwanaisha Phiri, one of the first 3 Malawian audiologists who is currently working at Queen Elizabeth Central Hospital as an audiologist. So I'll talk about my journey to audiology. Audiology is one of the professional I never thought of getting into because I didn't have an idea about what it was all about. I remember when I was in secondary school, one of my friends used to say that when she finishes the high school, she will be joining the nursing profession. But I said, no, I don't think I can be a right person to become a nurse. But lucky enough, things changed when I graduated from secondary school. I was motivated by my brother who had joined the medicine by then. He did medical, he was a medical doctor. So he was the one who sent me like an advert to say I should join nursing. So I started just getting interested to become a nurse. And then in 2004, that's where I joined the nursing training school and graduated in 2007 as a nurse midwife. Thereafter, after my graduation, I was posted to work at Queen Elizabeth Central Hospital, where I worked in the main operating theater for 4 years as a theater nurse. Thereafter, I was transferred to the adult emergency and trauma center, where I worked just for 1 year. But because I was a hard worker, one of the senior nurses said that I should join the team who were given like scholarships to go to study for audiology in Nairobi by the Sound Seekers, who are currently known as the Deaf Kids International. So I was among the 2, but we were like the number 3s because one had already gone to Nairobi to do the same study. And then in 2012, 2 of us, me inclusive, were also sent to Nairobi for the same course. But when I was told to join that course, I didn't have any idea about the course. So I had to ask the nurse in charge to say, what was it all about? But what she said was just like, no, don't worry, it's part of medicine. Because to myself, I didn't want to do any course that was not within the hospital, because I enjoyed working as a nurse. So I wanted to do only the job that will help me see patients getting well as they go back to their homes. So after the graduation in Nairobi, I was sent back to Malawi and then started working within the ENT department as an audiology officer, because here, if you have a diploma in audiology, they call you an audiology officer. So I worked for at least 2 years as an audiology officer within Queen Elizabeth Central Hospital. And thereafter, the same Sound Seekers, who are currently known as the Deaf Kids International, gave me another opportunity to go and study for a master's degree in the University of Manchester in England. Then I graduated in 2016, and since 2014 till today, I've been working as an audiologist now. So it's like I've been in the field of audiology at least for 6 years, and I do enjoy this job now.
Can you tell me one experience that you had in your professional life that has influenced the way that you communicate today? So just one experience, any experience, if you can describe it, and then tell me a little bit about how you felt.
Okay. So I'll share my experience about the type of communication I had once made to my patient that made our communication broke, but it happened like that without me knowing. But I later realized that I had made a mistake, and then I had to change my attitude so that it should be suiting the way I wake up today. So there was this other patient in 2014 when I was just few months out of school in Nairobi. When I came home, there was a patient who had like lost hearing following illnesses. He had had meningitis and then had developed a profound sensorineural hearing loss. So as he was coming to the hospital, his ideas was that when you go to, his friends had told him that when you go to the hospital, they will give you hearing aids that will enable you hear well, not knowing that sometimes hearing aids may not work to other individuals. But in his mind, he had that like intention, he had that hope to say that when I get into the clinic, they will test me and then they will give me hearing aids that will enable me hear same as I used to hear before I got sick. So I met this patient. He was a middle-aged man. Then after assessment, I realized that this man had a total profound neural hearing loss. And according to our capacity that we can't even afford like cochlear implant, I had counseled the patient to say that the hearing aids, the conventional hearing aids we have will not help him because his hearing level was so bad. But now we couldn't communicate well because this man did not even come with a guardian. He could not even lip read. He was a poor lip reader. And it was just like it had developed like some few weeks after like he had had meningitis. So he was not so sure about how to lip read and any other communication apart from maybe writing. And I had to write whatever I wanted to say to him, because just saying to him, he could not hear anything. Even if I tried to shout, try to expose my lips so that he can lip read, he could not do anything like that. So I had to write each and every statement I had to say to him. Then he could read because he was someone who could read. So in our conversation, what I had told him was that your hearing was so poor, is so poor. So hearing aids could not even help by then. So I did not give him like enough time to ask about his views or any other questions about what I had said. So the man had to leave the clinic before I had to clarify exactly like the way forward. Like, I did not explain the way forward. What I had said was like, this was because I did not give him enough time to air out his views. He went back home without knowing the way forward to say, okay, now I can't hear. Hearing aids cannot help. How will I live now from here onwards? I did not even refer him like to other organizations that could have taken from me now and continuing supporting this man. So this man went, but I didn't realize that I had made a mistake for not asking him if he had issues. So he had to leave the clinic without airing all what is in his mind. So this man, when he left, 2 weeks later, this man came back. Lucky enough, I was on duty also. So when he came back, he wanted to meet me. He did not want anyone else to see him so that at least he should finish up what was remaining in him. So when I met him, he told me that, of course, doctor, I do understand that you told me that my hearing level is so bad and hearing aids cannot help. But now, since that day when I met you till today, I'm just hearing as if people are making drums, are beating drums onto my ears, and I can't even sleep. So when he just said so, I realized that it was me who did not give this man enough time to air out his views. As a result, he went back home with stress. That's why tinnitus now had developed. So I had to put a blame on me because I really understood that it was me who did not communicate in full details to enable this man walk out of the clinic with a clear mind. So when he said so, I just said, okay, you know what? You are hearing those drums because you are stressed. You understood, of course, what I had said, but you still have stress. Is there anything that is giving you that stress? Now, this was for the second visit. At first, I had forgotten to ask him about that. So what he said was like, you know what? I am an electrician by profession, and I do have certificates. He actually brought those certificates to me this time around. So I looked at the certificate and saw that, okay, that's okay then. So what's your worries? So he said, you know what? I used to get a job using these documents. But now whenever I go to any company to ask for a part-time job, they are not even understanding what I'm saying. As a result, they always chase me even before me airing anything. Maybe they can just greet me because I didn't understand exactly what they are saying. Maybe I may end up saying something different. So to them, they feel like I'm mad. And as a result, they are not giving me a job. And as a result, it's me now suffering because I can't even manage to fend for my family, which I used to do before I had developed the hearing problem. So I said, okay, you know what? What I'll do this time around, I'll write a letter of support to say that you have a problem, but you still have your skills as an electrician. You can still perform, even though you can't hear, but people can still communicate to you using maybe through writing because you can read and write. And in addition to that, I'll send you to an organization called the Malawi National Association for the Deaf, which is abbreviated as MANAD, where they do counsel people with such problems, and you'll be able to meet other people with the same condition, and you can share ideas on how they are faring with their problem. And in addition to that, this MANAD, the Malawi National Association for the Deaf, will teach you how to lip read, and that will help you a lot as you perform your jobs as an electrician. And also this MANAD will link you to the labor office where they do have like vacancies, so that every time they have a vacancy, they will be able to share with you. So when I said so, I gave him the contacts for the Malawi National Association for the Deaf. And then this man went to MANAD. I had called also the MANAD people to say, I have a patient who needs your support. So they said, okay, let him come any day when he's free. So this man went to the Malawi National Association for the Deaf. He was so excited because he met some other individuals who were quite doing well despite developing like the postilingual deafness. And they were still working and they were still performing as they used to do even before they lost their hearing. So 2 months later, this man came back again to the clinic, now with a different face. He was smiling. So I was like, what is it that you are going to tell us today? So he was like, you know what? I'm here just to say thank you. When I went with the letter you wrote to me, I used that letter to to show it to the MANAD. So the MANAD people counseled me and showed me some individuals with the same problem. And we shared how they are coping with their problem. And as a result, I got another letter from the MANAD and was referred to the labor office. And the labor office has managed to share some of the adverts. And as I'm talking, I'm now working with a certain company, and now I can now afford to pay for my rentals and the school fees for my kids. So I'm just so excited that even though I can't hear, but now I can still perform the same way I used to do, in the same way I used to do before I became deaf. So I was now so excited this time that because of the way I had changed the same communication I used before, now it has changed to a better way. But at first, the same communication had made worse. You know, the man came to the clinic with no tinnitus, but with hearing loss. But because of the way I had communicated to this patient, he ended up developing tinnitus. Then he decided to come back. At the second visit, everything changed and the tinnitus was no more. And that was so exciting. So as I practice now onwards, I try my best not to rush patients. I always give them time, even if they have normal hearing. I do understand that if a patient comes into the clinic and say that I can't hear, and you do the assessment and you notice that they have normal hearing, you still have to have enough time to find more. What is it that it is causing them to say that they can't hear whilst they still have normal hearing? sometimes there might be like underlining stressful events behind them that is causing all this problem. So they may feel like they can't hear because of the stressful things they are carrying behind them. So I always try my best to find out more before I release this patient. I don't just say like your hearing is normal, leave and you go. No, I always try to probe more. Is there anything that is stressing you up? Have there been anything like in your office or at your home? Is there anything that is disturbing you? If they explain quite okay, then that's when I get to release the patient.